Hello and welcome to this week's version of Healthcare Careers in Focus. Today we'll be joined by Ronnie, who's our radiographer, and is going to talk to us about her career in radiography to date.
Thank you, Jordan. Hello, I'm Ronnie. I'm a radiographer and I'm also the radiology practice educator. And today I'll be talking to you about my career as a radiographer. So to start off with, I'll share with you my career journey that started in 2009 at the University of Derby. I undertook my diagnostic radiography degree, and that was a 3-year journey. I did my placements at Nottingham hospitals. I then got my first job in 2012 in Lincolnshire as a general radiographer. In 2014, I went into specialty in something that we call angiography. Angiography is a very interesting modality. Modality is something just like an area. So it is a very interesting modality in radiology. What we do there is we use imaging to look inside blood vessels. So we always call it something like plumbing work. If you think of pipes, of blood vessels as pipes, so they look for blockages. People with heart diseases, blood clots and things like that, they usually have somewhere where there is a blockage. So my job in there as a radiographer is to take pictures for the radiologist, who then when they see that there's a blockage in one of the blood vessels, they then do something about it, treatment, or open it up if they can. So that's what I specialized in. I then moved to Kettering in 2021, started working there as a radiographer again, and then I started my role in practice education because I wanted to sort of like maybe give back to the profession, train the new generation of radiographers. So that's what I've been doing since 2022, and now I do the same thing at Bedford. So that is sort of like my career journey in a snapshot. So a day in the life of a radiographer. On a normal day-to-day basis, if you think of a radiographer, we come into work, we work with technology. So you're looking at your machines, making sure that it's all working. So if you're working in CT, make sure that the machines are working. We have tests that we do, output tests to make sure that we'll get the good images for that particular day. If you're working in CT, wherever you're working, inspecting and calibrating machines is one of the most basic things that you do in the morning. We communicate with healthcare professions from other departments, so nurses from theaters, just to know what cases they have, when are we needed in theaters, and all the other departments that we may be needed. We also go to do x-rays on the wards. So we also speak to healthcare professions on those wards to make sure that the patients that need x-rays or CT scans come in a timely manner. We then have our morning huddle where we update one another on what the daily tasks are for that particular day. And then we all then just carry on with our normal day-to-day activities. So on a normal day, the CT radiographers, if you look at the image on the screen, top left, there's a CT scanner. So that's a CT radiographer who's going to spend their day doing CT scans. It could be head, it could be pelvises, whatever comes, they'll be doing that. If you go to the picture on the top right, that is a radiographer who is working in general x-ray. So they will be doing hands, feet, chest x-rays. So all things x-rays, they will be doing that on that particular day. And on the bottom left, we've got an image of a patient going into the MRI scanner. So that is a radiographer who will also be working in MRI, who will be taking those images. And the last image that we have on the bottom right is a radiographer in theaters who will be doing all the theater cases on that particular day. So that will be sort of like our normal day-to-day activities. So next, I thought to share with you a case study. A normal day. We've just talked about what we do on a normal day, but I'd call this a normal day until it's not, which happens probably once, twice every week. We've got a scenario here of an older couple driving to the beach with their grandchild on a Sunday afternoon, and they're involved in a car accident. Emergency services arrive and they're brought to the hospital. So here we are. What happens, the picture that we have here now is routine is put into the bin. The things that I showed you on the previous slide will not happen as we had planned. We now have an emergency situation. We now have to regroup. We now have to think, where are we needed in this emergency situation? So I'll pose a question for you. What do you think is the radiographer's role in this situation that we find ourselves in now? A car accident, we've got patients that are coming into the hospital. Right. So what we have now is a trauma call. And a trauma call environment is a fast-paced, high-pressure setting. It is very, very busy. And a radiographer is part of a trauma call environment. If you look on the picture on the right, you can see that there are so many people that are trying to help the patient that's on the table. And everybody has a special role that they will be doing to contribute to the well-being of that patient on the table. For us as radiographers in a trauma call setting, our job is to make sure that we produce high-quality images for the doctors and nurses and every other healthcare profession that will be taking care of that patient. We have our machines that we call mobile machines that we can bring to the bedside and take those pictures. It's a high-pressured environment. Sometimes you won't be able to move people from the places that they're standing because they are there sometimes to stabilize the patient. So you have to work with what you have. You have to be adaptive. You have to be a strong communicator to say what it is that you need. If you need help, you say it out loud. So communication is key, and communication skills are very important for radiographers. So as you can see, it is a very busy environment, but we do that. So I gave this example. The patient, let's imagine that grandfather has a head injury. The grandmother has a chest injury, and their grandchild has an elbow injury. Again, try to think, what is the role of the radiographer as we walk along this case study? So the grandfather who has a head injury, he will need to have a CT scan. So that is a picture of a head CT. And the grandmother who has a chest injury, she will need to have a chest x-ray so we can see if she's, injured her chest in any way. Then the grandchild who's got an elbow injury, he will also need to have an x-ray of their elbow. And that will show us the degree of the fracture if they have any. And according to that picture that we see on the screen, when you look at that elbow, you can see that it is fractured. So that is the role of the radiographer in the immediate sense. Next step, the role of imaging. So for the grandfather, we will still need to have CT and MRI images to assess the bleeding and to check for the progress of recovery. We will still continue to have chest x-rays for the grandmother. These will be follow-ups to make sure that the pneumothorax is resolving. The child will go to theaters to have the fracture fixed. And in theaters, we also work in theaters as radiographers. We will be providing live pictures for the surgeon who is doing that operation on the child. And post-surgery, when they go to fracture clinic and orthopedic, they will still come back for follow-up x-rays until the elbow, the chest, and the bleed are all fully healed. So we are involved in the road to recovery. Now, would you have guessed that we are involved in every part of the patient's journey? For many people, they don't realize that radiographers are involved from the beginning to the end of a patient's journey. I'm going to talk about the rewards of being a radiographer. For myself and for others, we love what we do because we can clearly see the direct impact that we have on patient care. Every day is different. We work with people from different healthcare professions, so we are not just in a corner doing radiology things. We work with nurses, we work with doctors, we work with physiotherapists. And there are so many opportunities to specialize. I spoke about my specialty, which is angiography, but you can go into CT, MRI, ultrasound. You can also be a reporting radiographer, and you can also go into education to teach the next generation of radiographers like myself. And now the challenges. It is a physically demanding job. We spend most of our day on our feet. High workload. Sometimes we x-ray up to 150 patients in a day. There's also risk to radiation. Now, on this point, I just want to stress that the radiation risk, the exposure to radiation is very, very minimal. You are not in the room while the patient is being x-rayed. We go behind the screens and we take x-rays while we are behind the screens. These screens are lead protected. So that means the x-rays cannot pass through anything that is lead. So the amount of radiation that we receive as radiographers is equivalent to radiation that you will be exposed to in our normal day-to-day activities, actually less than that. We also wear what we call radiation badges that will monitor the amount of radiation that we take in. And every month or so, we take our radiation badges to the radiation supervisors. They will check how much radiation we've received. If anybody, for any reason, has received more radiation than expected, then an investigation will be held. And I can say I've been working since 2009, and I have not come across anybody who's received more dose than they were expected to. The job can also take an emotional toll because of the things that we see. If you think back to the case study that I shared, it can be distressing sometimes. There's also repetitive strain and fatigue because of the machines that we work with, and sometimes we are in certain positions for a fixed period of time. So sometimes we do suffer back aches, shoulder aches, and things like that. And the last thing that I'll speak on the challenges is the limited recognition. We are the silent heroes. Not many people know what radiographers do, but as you can see from the case study that I shared with you, we are involved in almost every step of a patient's journey. So we are the silent heroes. Advice to my younger self, I would say explore all the career options and ask questions early. Go into the hospitals, go into the workplaces and see what the profession that you're seeking, what it is that they do on a day-to-day basis. Sometimes theory is very, very different from practice. Career growth takes many paths. If you go into one career, it doesn't mean that you're just going to be stuck in there doing that particular thing. I have now become a practice educator. Never in a million years did I think that's what my career path was going to be when I first started my role. You also have to develop strong people skills if you're going to pursue a career in healthcare. you need to be able to communicate and speak to people. And that is the advice that I would give to my younger self. Thank you very much.
Thank you so much, Ronnie, for taking the time to speak to us today. And thank you all for taking part in Healthcare Careers in Focus. We hope to see you next time. Bye.